Good morning. My name is Dr. Maria Patria Rita Mejorada-Sotelo, and I am a specialist in pediatric dentistry. And today, I am going to discuss or talk about the anatomy of the mouth. The mouth is also known as the oral cavity. The mouth is an oval-shaped cavity inside the skull. The three main functions of the mouth are: first is for eating or digestion. The mouth is the first part of the digestive tract. It receives food, preparing it for digestion in the stomach and small intestines. Next is for speaking or communication. It modifies the sound produced in the larynx to create a range of sounds. And third is for breathing. It acts as an air inlet in addition to the nasal cavity. So the oral cavity or the mouth has many parts. First is called the lip, or what we call labi. These are two mobile and muscular structures that form the entrance to the mouth. The lips mark the transition from skin to moist mucous membrane. The teeth, or what we call ngipin. It is the hardest part of the body and is used for chewing or grinding food, or what we call mastication. Next is the hard palate, or what we call ngalangala. This is the bony front portion of the roof of the mouth. The soft palate is the muscular back portion of the roof of the mouth. The retromolar area, or likod ng bagang. This is the area behind the wisdom teeth. Next is the tongue, or dila. This includes the front 2/3 of the tongue. The gum, or the gingiva, or in Tagalog is gilagid, are soft tissues that cover and protect the alveolar bones that cover the teeth. The uvula, or in Tagalog, tilao, a soft flap of tissue that hangs down at the back of the mouth at the edge of the soft palate. It acts as a valve to keep food from entering the nasal cavity. The tonsil. These are a pair of soft tissue mass located at the back of the throat. They act as filters, trapping germs that could enter the body. The buccal and labial mucosa, or lining ng labi at pisngi. This is the inner lining of the lips and cheeks. And the floor of the mouth, or ilalim ng dila. It is a horseshoe-shaped area under the tongue, between the sides of the lower jawbone. And going back to the main functions of our mouth, which is for eating or chewing food, and speaking or speech, the teeth is a very important part of the oral cavity. How well do you know your pearly whites? The teeth are the hardest substances in the human body. Its outer layer, called the enamel, is even harder than bone. Besides being essential for chewing, the teeth play an important role in speech. Without our teeth, the major functions of the mouth wouldn't be possible. So having a complete set of teeth is of great importance. The teeth is also called ngipin in Tagalog. There are two sets of teeth in a human's life. First is the primary teeth, or the baby or deciduous teeth. These are the first teeth to erupt into the oral cavity. The primary dentition is comprised of 20 teeth, 10 in the upper and 10 in the lower. Often, these teeth are referred to as deciduous teeth. These teeth will be exfoliated or lost as the permanent teeth erupts. Next is the permanent teeth. The permanent dentition is comprised of 32 teeth. There are 16 teeth in the maxilla and 16 teeth in the mandible or the lower jaw. But first, let me discuss about the tooth's development. This is just a brief discussion. It starts to develop at 6 weeks of intrauterine life, meaning when a mother is pregnant and there's a baby inside her womb, the tooth or the tooth buds starts to erupt when the embryo or the fetus is at 6 weeks of its life. Primary teeth erupts at 6 months to 1 year of age, and the permanent teeth starts to erupt at 6 years of age. Parts of the tooth. A tooth is divided into two basic parts. The crown, which is visible, white part of the tooth, and the root, which you can't see. This one. The root extends below the gum line and helps anchor the tooth into the bone. Your teeth contain 4 kinds of tissue, and each does a different job. These include the enamel. This is the visible substance that covers the tooth crown. Harder than bone, enamel protects the vital tissues within the tooth. Enamel is made up of hydroxyapatite, phosphorus, and calcium. The dentin. Underneath the enamel, you find dentin, which is calcified and looks similar to bone. Dentin is not quite as hard as enamel, so it's at greater risk for decay should the enamel wear away. The pulp is found at the center and core of your tooth and contains the blood vessels, nerves, and other soft tissues that deliver nutrients and signals to your teeth. The cementum is the tissue covers this tissue covers the tooth root and helps anchor it into the bone. It's softer than enamel and dentin. The best way to protect this softer tissue from decay is by taking good care of your gums. Cementum has a light yellow color and is usually covered by the gums and bone. But with inadequate dental care, the gums may become diseased and shrink, exposing the cementum to harmful plaque and bacteria. So the cementum is the part that covers the root, and you cannot see it when you look at your teeth in the mirror. Only the enamel is the one that we see with our naked eye. The cementum is hidden by the gums and the bone. My question is, are all teeth alike? Take a look in the mirror and check the edges of your teeth. So not all teeth have same shape and size. There are 4 types of teeth and each differs in use. Each type of tooth has a slightly different shape and performs a different job. Types of teeth include incisor. These are the teeth with sharp edges and that you use to cut and take bites of your food. They are like scissors, Hence, it is called incisor and are usually the first teeth to erupt at around 6 months of your baby teeth and between ages 6 and 8 for your adult teeth. They are called cutting teeth. Canines, or what we call fangs. These are your sharpest teeth and are used for ripping and tearing food apart. They are called tearing teeth. Premolars or bicuspids are broad and flat and they act as nutcrackers. They are used for chewing and grinding food. They take the places of the first and second primary molars. They are called the cracking teeth. And the molars are broader than the premolars. They are also used for chewing and grinding food, so they are called grinding teeth. To summarize, the slide shows the different types of teeth and their position in the arch or jaw. The green color are the incisors, located anteriorly or in the front. This is used for cutting. The green one, this one, and one in the lower. Used for cutting. We have 4 in the upper and 4 in the lower. So we have 8 incisors, all in all, both primary and permanent teeth. The orange color are the canines, used to be called the cornerstone of the mouth because they are found in the corner of our jaw. Used for tearing food. We have 2 in the upper and 2 in the lower. So we have 4 canines, both primary and permanent teeth. Next is the yellow for premolars are not present in the primary teeth. So here, you cannot see a yellow color or the premolars. We do not have premolars in the primary teeth, only in the permanent teeth. It is used for cracking and crushing the food. We have 4 upper and 4 lower premolars. So we have 8 premolars all in all for the permanent teeth. Blue for the molars, located at the back portion of the mouth. Here. This is used for grinding food so it will be easily absorbed by the body. We have 12 molars for permanent, 12, and we have 8 molars for primary teeth. So you see, your teeth and the structure of your mouth play important roles in your ability to eat, speak, and stay healthy. Most of us take our teeth for granted until something goes wrong. Not only do our teeth help us chew and digest food, they also play an important role in speech and impact our health overall. It simply affects our quality of life. By learning about the basic dental health, you'll be taking the first step towards giving your teeth the attention they deserve. Remember, teeth also matters. So once again, I am Dr. Pat Sotelo, and thank you for listening and keep your teeth in great shape. Bye!